if we have the threat of pandemic influenza and we fail in primary prevention, then we have to think about secondary prevention. How do we minimize the spread of the virus? And tertiary prevention, how do we care for the people who are sick from the virus? So we have to learn from all the mistakes we've made in this cycle. So we did not have adequate means to protect our healthcare workers. We had a shortage of PPE, and we also did not know much about whether the expiration dates of our masks were really legitimate. People were not using expired masks. It's possible those masks were perfectly fine. We were not sterilizing masks. It's possible that the use of the aerosolized hydrogen peroxide is going to be a superb way to reuse masks. We didn't have proper access to gowns, and we have to research gown reuse. Perhaps we can reuse gowns with sterilization. We had too few ventilators at very high cost. We had to build them in a frantic effort rather than have them in a stockpile that could be brought out to respond to a pandemic. We've also had the scandal in the United States of having discovered that we had major government contracts for mass production of N95 masks, and the contractors learned how to manufacture these masks in bulk, so they could have produced hundreds of thousands of masks per week, but then we never produced them. We learned how to do it, but we never did it, and we never stockpiled them. We also had a scandal of a ventilator contract with a company that was subsumed by another company. Well, the other company made expensive ventilators, and they were probably not motivated to continue a government contract to make lower cost ventilators. So no ventilators were manufactured. Millions of dollars were spent by the US government to get ventilators, but they weren't produced, nor were they purchased elsewhere and stockpiled. So we were unprepared. When I was in Shanghai about 10 or 12 years ago, I visited an infectious disease hospital in Shanghai that is out near Pudong, and it's far from downtown, and it was newly constructed after the SARS epidemic to have better capacity. And I was so inspired to see a very large field, and it looked just like a field, and they mowed it, and I thought perhaps it was a small park just to have it pleasant. But I didn't see park benches, and they told me it was the tent hospital. And they showed me the underground caps, and when they took off the cap, there was a line for oxygen, there was a line for water, there was a line for electricity, multiple lines, and they also had a cap for sanitation and a different cap. So underground, they had put all the infrastructure, and they told me that they had a tent in storage that could be mounted in about 6 hours with all of the connections, and they had beds in storage, so they could set up a tent hospital in 6 hours. Now, we did the same thing in the US. The Jacob Javits Convention Center, which is known to conventioners around the world who've come to the US for conventions. This is a very large convention center, but it wasn't prepared in advance to be a hospital. So at much higher cost, we were able to turn that into a temporary hospital. Similarly, we took the Navy hospital ships at very high cost to the New York Harbor. instead of being prepared. And I was impressed that the religious organization, Samaritan's Purse, set up a tent hospital outside near Mount Sinai Hospital in Manhattan, in part of Central Park. And they were able to do that at very low cost. So I think, we have to learn from each other. We have to learn from Doctors Without Borders and Samaritan's Purse, the people who know how to mount field hospitals. The U.S. Army knows how to mount field hospitals. And the Chinese have developed these systems where they have plans where they can build a hospital in 2 weeks if they have to, or they can put a hospital up in 6 hours if they have to. So we need to teach each other how to do this. And the United States and the other countries, Italy, Spain, Iran, all around the world, have to have pandemic preparedness. So I'm frustrated because I've been doing infectious disease epidemiology for 40 years, and it's not uncommon that we know what to do, but we cannot get the resources to do it. And we write our reports, we do our scientific. So in some ways, I feel like a failure. I am not effective at communicating the urgency of these matters to the American voter.